So the journey to high-value healthcare, as I mentioned, we developed this early on. I'd say the first time I used it was probably around 2008. And at that point, we were looking at 3 stages. We published it and got it out there to the industry right around the time of the HITECH Act, or when meaningful use was first deployed. We had a healthcare system that we'd had for 50 years. It's what I call 1.0, very bricks and mortar, very hospital-centric, and we needed to deploy technology into this world. EHRs were out there and had been out there for 10, 15 plus years, but to get full adoption, the federal government incented us through meaningful use to invest and deploy these systems. Interestingly, at that time, these systems had huge impact in terms of their cost, but in terms of actually changing the way we practiced and delivered care and did our work, the impact was more limited at that point. Organizations had what we called a check the box mentality. Okay, if I do these things and implement this certified record, then I will get my meaningful use incentive dollars. By about 2.0, the industry began to realize they needed to optimize those systems, but they also needed to invest in technologies focused on data and analytics. While a lot of academic medical centers and some large health systems had data analytics departments or tools and they had data repositories and other tools, they weren't fully deployed or being used effectively. So in 2.0, which was around 2015 time period, we saw organizations getting serious about data analytics. And I must comment that 1.0 to 2.0 is additive, as are the other stages. You're never quite done. And we'll find some organizations may even still today be predominantly 1.5, or even early stage 2.0. So no 2 organizations are in the exact same place. By 3.0, which is today, we're beginning to deploy new and different digital tools. A lot more is in the cloud. Everything in 1.0 is still pretty much premise-based, and IT departments were used to building big teams of people to deploy those systems. By 3.0, we see a lot more in the cloud. We see a lot of enterprise systems still in existence, and a lot of the technologies that are being deployed today kind of fill the gaps or fill the white spaces between all of the enterprise systems and help us do very targeted efforts and targeted solutions. We also are doing more to reach out to the patient, to the consumer. This is why we call this period the systems of engagement. And what we're doing with interoperability and data exchange, we're beginning to involve and engage entire clinical care teams during this time period. In the future, as I mentioned, this is going all of the way to 2030 or so, when more Medicare members will be on value-based care contracts. We'll be doing systems of innovation where we really reinvent the care process, the payment process, and the wellness process. Smart health communities will become a thing. They're very ecosystem driven, not just what's going on within an enterprise. So we will see a future where we are able to look at the whole person no matter where they're getting their care. And the technologies will allow us to be proactive, use AI to be creative in terms of developing personalized care protocols for our patients.